Hello everyone, welcome to our MISI Education Online Health Talk. Today we'll talk about stress, how to manage stress. It's a very common problem and we have to face it every day. In fact, most of us will face stress almost all the time, and it's just a matter of how to handle it. So for the next 15-20 minutes or so, we're going to talk about what is stress, source of stressors, and management technique. So stress is a relativity. Is when the outside demand is greater than your resources that can cope. So it can be the either physical or psychological reaction that we have in this unbalanced situation. Maybe a situation that you consider stressful, but your neighbor, your friend will find it simply thrilling and it's not that stressful. So it's very subjective. And it's a critical element in psychological experience of stress, not the situation itself, but your judgment of it. Now, what are the source of the stress? Or we call it stressor. It can be a physical or psychological stressor. For example, physical, after invasive surgery because of the pain, lack of sleep and causes stress next day. Psychological, for example, that evoke negative emotion, for example, from hate, anger, sadness, or fear as a source of the stress. It can be in the chronological life. The stress can come from past, present, or future. For example, past history of the traumatic childhood experience, or the current one. I have a deadline to catch. Tomorrow I have to submit my assignment, or sales quota for those working in sales line. Or even the stressor can come from future. It has not come, but we start thinking about it, worry about the outcome of certain project, outcome of our fate. So like for example, the tax day also, the source of stress also can be a positive or negative stressor. Positive means something that very positive, happy event, but because we worry too much, it becomes a stress as well. For example, promotion, getting married. Or it can be from the negative event that induce the stress, the event that are harmful or negative. Now, stress also can come from acute or chronic state. Acute come on suddenly, last for a relatively short time. For example, car breakdown on the expressway, what to do with it. Or can be chronic, have been going on for so long and never go away. Like for example, someone involved in a bad relationship, being stuck in an unsatisfying job. And this chronic stress will wear us down in time, physically as well as psychologically, and lures people into simply learning to live with it rather than trying to improve it. And if they address the core problem or learn how to cope with stress, they will be better equipped to avert or lessen the potentially damaging side effect. Now, it's important to recognize it when it is more than stress, because stress can be a common phenomenon from day to day, but it goes beyond. Then we have to recognize it as a potential problem. We feel fearful most of the time, uneasy or distressed, although they may or may not be obvious reason for the fears. And it's called, usually recognized as generalized anxiety disorder, post-traumatic stress disorder, or acute stress disorder. You can see the stress and this disorder are two different things. It's a magnitude of it. So how to manage stress? To balance the stress with more positive experience, help maintain a healthy mind and body. It's not merely helping to live a more pleasant life, but a longer one. Now, a few techniques, for example, we have to practice relaxation response or similar techniques. For example, progressive muscle relaxation, visualization, relaxed breathing exercise, and other means like, for example, maintain a healthy diet, write down about the stress, express out the feelings, deflate the danger of your fears, remove the stressor, manage the time accordingly, exercise, socialize, and seek therapy if all above fail. Now, what are the techniques for like practice the relationship response? Like meditation is one of the very good example. Spend some time at rest, sit some place that is comfortable, close the eyes and relax your muscle. Focus on the breathing. Make it very regular. Continuously repeat one word, relax, relax, relax. So that will ease the mind. Progressive muscle relaxation also is another technique of relaxation response. Focus on each muscle group and become familiar with the sensation of relaxing the entire body. Mentally imagine the tension evaporating as you release the tense in each muscle group. And focus on the warmth and heaviness of the body part as they relax. The other type is do visualization. Visualize a pleasant place is a good way to remove yourself mentally from a stressful situation. Imagine you are someplace that makes you feel good and relaxed. And focus on all the five senses, what you will see in that visualization, what will you feel, hear, taste, and smell. The other very useful technique also is called relaxed breathing exercise. This YouTube is widely available. You can search it from YouTube to how to do a breathing exercise to relieve the stress. Take the deep breath in and out in a relaxed sleeping state. With each breath you take, focus on the breathing and write down your stress. They will improve in the immune function, and it is proven that you elicit fewer visits to the doctors and increased sense of well-being. And for example, the death of the loved one, relationship difficulties, a serious problem affecting someone close. In those particular situations, write down the stress can be very helpful. Express the feeling. Resilience to stress, including disease-related distress, is associated with how people handle their emotion. Suppressing that negative feeling and maintaining that upbeat or rigidly positive attitude does far less to reduce stress, letting the feeling out. So being assertive in communicating your feelings, which in turn can lower the stress level, can have a significant effect on medical condition. Now, deflate the danger of your fear is another very good technique. Whether you have to think of yourself whenever you stress, you have the fear, ask yourself whether the situation merit as much as stress you feel. In fact, it may not be so. Ask yourself, what is the worst possible outcome can develop from this situation? After all, when you think about it, nothing will happen, nothing bad will happen. How likely it is to happen? And how would such an outcome change your life? A lot of time, whatever outcome it is, it won't change your life. So have you done all that is possible to influence the result? Take action, eliminate the fear, eliminate the possible outcome. So help free you from the stress that you cannot avoid or control, or can at least help to diminish it. So for example, assignment is coming up, deadline is coming up, you cannot avoid, and start thinking about it, or what score, what mark can I get. So think positive, how bad it can be. Actually may not be that bad as you imagine. Remove the stressor if you know the stressor. Set some limit to ourselves. Determine what we can realistically do and cannot do. And must know how to say no. Simply stop promising more than we can reasonably handle. For example, no, with the current responsibility I can't take on more at this time. Otherwise, you're asking for unnecessary burden and stress. Time management is very important. If you lump everything together, you don't know how to manage your time, that is a stress that where it comes from. Demands or priorities. Put which one will come first, which priority you have to do first. Write it down. Arrange it accordingly. And write a list of items, schedule time to work. Write down the timetable so that you won't always keep in your mind what to do. Leave it, put it in a timetable, do accordingly. A plan or strategy to follow. Maintain a healthy diet is very important. Don't underestimate it. I know a lot of people, when they stress, they tend to eat a lot of unhealthy food. That in the long run will be detrimental to the health. So we always advocate routinely, daily, we have a healthy, balanced diet. So effort to keep eating a balanced, nutritious diet and eat comfort food in moderation. Maintaining a good diet may help reduce the stress in the long run. Exercise is another very useful way. For maximum effect, try aerobic exercise. It distracts us from whatever it is that is causing the stress. Help us to eliminate excessive energy and feel more capable of handling challenges and build up our confidence. Socialize. Having a supportive friend, family, colleagues is one of the most significant ways to reduce stress. Discuss your difficulty with someone that you trust. Participate in a larger social event such as a sport team, a spiritual group. However, be careful. Certain situations that, for example, crowded place, a big group, make you feel uncomfortable, that where you cannot relax and enjoy yourself. It may be harmful, may be doing more harm than good and increase the stress. So you have to find a balance where which environment, which group that you're comfortable with, and how big the size of the group that you're comfortable with. Now, if you think that you still can't cope by yourself, then it's time to call for help. Help available from senior fellow, those with the experience, with the knowledge, and with the educational background, in particular about handling stress, for example, psychologist, counselor. So how to cope, they will teach you how to cope with stressful conditions with less difficulty, how to better handle conflicts, manage anger, and simply communicate with other people, how to resolve some of the problems that causing the stress. Thank you.